Welcome to Novant Health in Focus. I'm June Baker, and I'm here today with Dr. Nicholas Kallay, who specializes in pulmonary and sleep medicine. Dr. Kallay practices here locally at Novant Health Pulmonary and Sleep Medicine in Shallotte. Welcome to the show today.
Well, thank you very much. I appreciate the opportunity to speak with you.
It's my pleasure, and it's about a topic that I am really vested in and need to know more, as my husband is a patient of the practice and suffers from sleep apnea. So this really rings true to me. So let's just get started, and I think that people underestimate how important quality sleep is. Would you agree to that?
Oh, very much so. Sleep has such a broad-ranging effect on human health. If you just take insufficient sleep, for instance, studies do seem to show that insufficient sleep leads to an increased risk of high blood pressure, diabetes, heart disease, certainly psychiatric issues, depression, anxiety, stress,
Wow.
and even some studies suggesting increased risk of motor vehicle accidents.
Wow, I didn't realize. I knew it affected your general health, but that's a lot. So how many hours of sleep should an adult have?
Well,
I'm sure there's not one number. It's
sure. Conventional wisdom is that most adults need somewhere between 7 or 8 hours of sleep. Children typically need more. Now, of course, this is an average, meaning some people don't need that much,
Right.
some people need more. It's actually, when you get right down to it, the most common cause of people being fatigued and tired in this country is actually insufficient sleep. I mean, we're all busy doing
Right.
things during the day,
Right.
lots of priorities, and usually sleep ends up taking it in the neck, and you end up getting less sleep than you should.
Are there warning signs for sleep disorders?
Certainly there are. They have something of a tendency to be a little nonspecific, but obviously unrefreshing sleep, fatigue and sleepiness during the day. Sleep apnea, which you mentioned earlier, is one of the more common sleep disorders, and certainly that may have bring along with it snoring, bed
Snoring,
partner.
that's a big one.
Snoring, that's a big one. Bed partner may notice pauses in the breathing when the person sleeps. Mostly if you're having substantial issues with fatigue, tiredness, sleepiness, that sort of thing, and if you don't really have a good reason for it, then you should be kind of suspicious about what might be going on and consider investigating.
So you should not ignore those
Sure.
signs. Yeah. I know sleep apnea is very common. I see, you go to the airport and here's all these guys carrying their,
Yeah.
my husband included. So can you describe the condition for our viewers?
Sure. So sleep apnea basically is what the word says, or what the phrase says. Happens in the sleep, and an apnea, which means a pause in the breathing. Now, there are different kinds of sleep apnea. The most common kind is obstructive sleep apnea. What's happening with obstructive sleep apnea is your breathing passage in the back of your throat, usually nice and open, allowing air to go in and out of your lungs when you breathe. That breathing passage has a bit of a tendency to kind of collapse down and block off during the night,
I see.
making it so the body's having to work extra hard to get breath past that blockage. And as you might imagine, having to work hard to breathe when you sleep at night leads to a not very good night's sleep. You tend to be more fatigued and tired the next day, that sort of thing.
How do you treat that?
Well, most of the treatments for sleep apnea involve trying to do something about that fundamental blockage problem, tries to do something to keep the breathing passage open. So the most commonly recommended form of treatment in adults is this thing called CPAP. CPAP stands for Continuous Positive Airway Pressure. It's a mask-based sort of treatment. You wear a mask when you go to sleep at night. There's lots of different kinds of masks. You usually wear whichever one is most comfortable for you. The mask is connected by a little tube to a little box on the side of the bed, where the little box on the side of the bed usually just takes regular room air and then delivers it through the tube to the mask, to the breathing passage under some extra pressure. The extra air pressure delivered to the breathing passage acts as a little air splint to kind of help hold open the breathing passage to keep it from collapsing down and blocking off. Now you need to do something to figure out what's the right amount of air pressure to achieve the desired air splinting effect, but that's basically how it works. Now there are other treatments that can be used for sleep apnea, including things like an oral appliance. That's a mouthpiece you put in your mouth when you go to sleep at night, sort of a bite block mouth guard kind of a thing.
Right.
What that's supposed to do is it's supposed to kind of nudge your jaw forward a little bit. And by having your jaw nudged forward, that's supposed to tug forward on some of the soft tissue at the back of the throat to try and tug open the breathing passage to keep it from collapsing. There are also some surgeries that can be used to treat sleep apnea.
Right.
Some of the most common kinds of surgeries involve basically doing something to remove any extra soft tissue at the back of your throat that you don't really need to try and open up a bigger breathing passage that's less prone to collapse.
In your opinion, of those options, which is most likely to help?
Well, the CPAP is the gold standard in adults.
That's what I thought.
Most reliably effective and safest form of treatment. The other treatments can work well in some people, but they're not quite as reliably effective.
Great. Well, thank you so much for being with us today. I know it's a huge topic, and I'd love to have you back sometime to discuss further.
Sure, happy to come back anytime.
Thank you so much, Dr. Kallay. It was nice to have you.